Hello everyone, this is Priyanshu Kumar
And AYUSH Gupta.
from the Department of Information Science and Engineering. In this video, we'll be discussing about science behind depression. Gradually, people are realizing how important these issues are these days, yet not talked about in our country.
Guys, we know that there are various misconceptions, myths, and misinformation spread out in the society about depression. Before moving on, let's remember an incident happened about 2 years ago, of which we all are aware of. The Sushant Singh Rajput suicide case.
Sushant Singh Rajput, he was rich, famous, had a huge fan following, everything an ordinary man just aspires to achieve in their life. But according to his doctors, before he committed the infamous suicide, he was suffering from a severe depression. This proves that despite having everything that an ordinary person can just imagine to gain in his lifetime, a person can be depressed. Therefore, depression should be considered as a disease or at least a manifestation of a disease.
Now comes the question, what is depression? In technical terms, WHO says that depression is characterized by persistent sadness and a lack of interest or pleasure in previously rewarding or enjoyable activities. Actually, depression is a mental state of low mood and aversion to activity, which affects more than 3.5% of the global population. According to experts, there are several reasons that may cause depression in a human being. One of them is genetic inheritance. Expert claims that a person who has a relative with depression is almost 5 times as likely to develop it compared to someone who does not have a relative with depression.
Now, we shall discuss about the next possible cause of depression in an ordinary man. Long sustained stress and many other biological activities at micromolecular levels in a human body are often the reasons of a depression in an ordinary man. Let's take an example of postpartum depression. Postpartum depression is a mental health disorder which a woman suffers just after the pregnancy. Soon after the delivery of baby, there are several sudden biological and hormonal changes in a mother's body which leads them to the postpartum depression. Now, people in general think that the mother should be happy because she has just given birth to a child, but they cannot accept a small fact just because of some pre-assumed misconceptions.
Okay, so the next major cause of depression in a human body may be referred as intrapersonal factor. Generally, people are born with certain personality traits that contribute to our overall way of thinking and behaving. For example, being very sensitive to anticism and introversion may lead to depression.
Moving further, it is also seen that there are several environmental factors which may lead to depression in a normal person. Several actions such as continuous bullying or a long sustained stress or even any significant loss of money or a person can cause depression in a normal person. Experts also believe that any large scale disasters such as a war or a famine or a pandemic that we all have experienced in the form of COVID 19 can lead a big number of people to depression or anxiety. Hence, we can conclude that depression is not just a psychological problem. Genetical factors, biological factors, social factors, all these things lead to a depression in a normal human being.
Sadness is a human emotion that all people feels at certain times during their lives. Feeling sad is a natural reaction to situations that cause emotional upset or pain. Sadness occurs for an acute period of time, whereas depression lasts way longer. It is the general tendency of people that they express their emotion of sadness, but a depressed person may or may not seem sad, but actually suffering from various internal conflicts.
So, now, after discussing all the causes, let's focus on how to treat a depressed person. First and foremost thing a depressed person can do is to consult their family members or their close friends. They can discuss their problems with their close ones and ask them for their help in relieving the stress. There are also a few recommended treatments as in yoga or a meditation. So that was the video guys. We hope that you found this video informative and useful.
And before winding up, we would like to thank our Professor Mani Asa sir for providing us this opportunity to come up with this video.